Welcome, Town Administrator Sean CADIME. I hope everybody is doing well and safe. It's been a couple of months. Hope you've enjoyed your vacation so far, your summer. As I mentioned, it's been a couple of months since I've provided a last update to the town, and I wanted to take this opportunity to just give you a couple of new updates in terms of COVID-19, where we are with the town of Seekonk, and operationally from different departments. I'll start with some COVID updates. Just really want to remind everybody just to follow the guidelines and take the necessary precautions that the state and federal government is advising. For the month of July nationwide, we've had 1.9 million cases just in the month of July, which is extremely high and is a monthly record since COVID-19 has really hit the United States. Massachusetts has done extremely well compared to other states. That's a good sign. However, we're starting to see these case numbers fluctuate again. So again, please take all the precautionary measures that are necessary. Wear your masks. Ensure that we're practicing social distancing. Adhere to the large gathering protocols. It's very important that we continue to follow these guidelines. In terms of numbers for Seekonk, the town of Seekonk has seen 9 new cases for the month of July, so I just want to bring everybody up to speed on that. Also, just a reminder to any person that is completing the antibody tests, you should also be requesting simultaneously the PCR test. We've seen a number of, especially employees here in town, particularly with public safety, going for the antibody tests. Those tests are coming back positive. However, when you get the PCR test, those tests are coming back negative. So it's really, really important that you do run both tests to make sure that you get a true understanding whether or not you have a confirmed case of COVID-19. Also, when you're getting these results, we're starting to see the significant delays in the reporting of the PCR results. The average lead time is now 7 to 9 days. This is a nationwide delay as more and more people are starting to get tested. So again, I know we're feeling comfortable. Seems like we're getting back to some normalcy as we start to see our restaurants opening up. We're starting to enjoy this warm weather. Please, again, adhere to the guidelines that are in place. From an operational standpoint, Town Hall is open. We just require and request that everybody coming into the Town Hall to conduct business, that they do wear masks and try to limit the congregation and communication with other individuals unless it's with a department. We are still urging folks to try to pay their bills online when possible. Human Services and the Veterans Office are open by appointment only to clients. They are doing a phenomenal job of trying to reach out and make sure that everybody is being serviced and getting the needs that the required needs, meeting their needs moving forward there. Board of Health wanted me to provide some updates to you folks. Mosquitoes and EEE is very active this season, very early on in the season. I really want to stress the importance of yard maintenance and removal of standing water. We've had significant increase in maintenance complaints this year, so please do some yard work, remove the standing water when possible. Also, I know we talked about COVID-19. We're starting to get into flu season as well. We just really want to notify the town that the Board of Health will be receiving their vaccine in September, so you can come in and request the shot if you feel like taking a flu vaccine. Human Services, they're beginning to host their outdoor activities and gatherings, weather permitting, of course. All clinics and activities require advanced sign-up, so please call Brittany Ferrier at the Senior Center. During the quarantine months, their staff has been extremely busy behind the scenes, calling over 3,500 seniors just to check in to make sure that they're doing well, that they're receiving the services that they need, whether it be food or medication. So I want to once again acknowledge Brittany Ferrier and her group over there at the Senior Center in Human Services for doing a phenomenal job to make sure that all our citizens are not going without during this pandemic. Parks and Recs, the Town Hall playground is close to being finished. If you can take a ride over to Town Hall, you'll see that playground is looking beautiful. It's not quite finished yet, but should be finished in a couple of weeks for you and your family to enjoy that with the children. Also urge you to continue to use our trails. We've got a number of trails throughout town. We also have some rock gardens throughout town and on those trails. We encourage anybody that likes a rock in the rock gardening to go ahead and take that. We just ask that you replace a rock so that somebody else can paint the rock and we can continue to have this rock garden. For the animal shelter, as everybody knows, the animal shelter is a brand new animal shelter. We're up and running. I would urge anybody that is looking to adopt a cat or any other animal, see what type of animals that we have in the shelter that we've rescued, to stop in and pay a visit to Sharon and Andrea over there and to take a look at the new facility. We will be having a grand opening hopefully this fall so that the town residents will be able to take a quick tour of the building and see the amenities that we have put in place. And then lastly, to the class of 2020, I had the opportunity to attend the graduation on July 24th. Myself and the Board of Selectmen really want to take the opportunity, and the entire town as well, to just acknowledge the graduating class of 2020. We wish all of our best wishes to the class of 2020. You have many reasons to be proud of your accomplishments, not least of which is persisting through the last difficult semester that you had to endure. We wish you good luck in all your future endeavors, and we know you'll make us proud. Thank you. I hope everybody out there has a great summer. Thank you.